Rethinking what I choose to eat to stay healthy.
Choose Smart Plate.
Rethinking tobacco prevention.
Fight with fact. Rethinking drug prevention. Drug drop boxes. Woo!
Rethinking access to mental health care in our community.
Rethinking where we get our food. School gardens.
Rethinking my choices at school lunch, locally grown, healthy, and delicious.
Rethinking talking to parents about sexual health.
Rethinking getting to school. Walking school bus.
Rethinking getting from point A to point B. Drive your bike.
Hello everyone, and welcome to Rethink, Your Life, Your Choice. We bring community leaders, advocates, and residents like you together to find solutions to some of the important prevention and health issues we are faced with every day. I'm your host, Emily Deeringer. Thanks for joining us. We are excited to transform Winnebago County into a community focused on implementing solutions for better health where our residents live, work, learn, and play. Today, we are showcasing a few great initiatives going on in the area that Rethink is involved with. My first guests are Penny Robinson with ESTHER and Susan Garcia Franz with the Winnebago County Health Department. They are here to talk about an emerging alliance called Fox Valley Thrives. Welcome, and thanks for both of you for being here today.
Thank you for having us.
All right, so Penny, ESTHER is where you're affiliated with, and could you just explain a little bit about what ESTHER is and what they do?
I would love to. ESTHER is an interfaith community organizing group. We are part of a statewide organization called Wisdom, and we have members affiliated with the Christian faith tradition, Muslims, Jewish people, Unitarian Universalists, and people who are not affiliated. So we live out our faith values, such as compassion for our neighbor and for those who are marginalized and feel like they have no voice. And we do this by offering leadership training and helping individuals to find their own voice to bring about change. We do not provide services such as giving out diapers or food. Instead, we try to bring about structural change so people don't need those services and they can become more self-sufficient. Currently, we are working on 3 main areas: prison reform, immigrant rights, and public transportation.
Awesome. So, and that's part of what public health is working on as well. Kind of some of those, one of the buzzwords in public health is upstream, and that's kind of where we've had this aha moment of aligning some of our efforts along some of these upstream kinds of structural changes kind of at the systems level of how our communities work. So that brings me over to Susan, who's with Winnebago County Public Health. So can you talk a little bit about this new emerging alliance called Fox Valley Thrives with public health and wisdom coming together?
Absolutely. So Fox Valley Thrives is really a local initiative that we're bringing together community organizing leaders like ESTHER and multiple public health professionals, planners, community organizations, and public health. And we form a strategic alliance aimed at making healthier communities and through collaborative action. So this group has a core team of leaders. We meet, we come together, we discuss what some of the issues are out there, then we work together to decide trainings, summits, how we can get at these key issues out there.
And how is this partnership going, both of you, from kind of the wisdom, faith-based community side and the public health side? How is this new partnership going? Working with new people can be kind of interesting at times.
It has been very interesting. Much of our work depends on relationships. So we have spent quite a bit of time, at least a couple of years, just getting acquainted with each other and with how our very different organizations operate. For much of the time that I've been involved with ESTHER, we have been challenging government officials and sort of seen government as somewhat of an adversary. So to be able to working directly with people who are part of our government has really been exciting for me. We have learned new vocabulary, but early on we, ESTHER and organizers, realized that health really was very connected to everything we were working on. So this has been very exciting. And we realized that incorporating ideas, information, and skills from these different organizations has really added to our collective impact without adding a lot more work. We're very appreciative of the resources that public health and planners have. They have access to lots of data and research. They're very amenable to working and getting things done. And they have a lot of different skill sets. So ESTHER brings a history of engaging people in the pews and ordinary people and lifting them up, providing leadership training. And I believe the whole community is perking up, recognizing that there's this new alliance bringing a lot of different assets together. And ESTHER has a history of engaging our legislators and working with them. In fact, we have relationships with many who have been here a while.
And from the public health side, how is this working? How is this going?
Right. I think it's going wonderfully. I think public health really, one of our goals is making people's lives healthier and living longer. And working with collaboration has been a big part of that, working with other community members. So this has been critical with public health, of really working with ESTHER, working with many different organizations, community organizations, to combine together with their roles and our roles to look at that health in all policies type perspective of where we really need to keep in mind that we want people to live healthy and we want them to live longer. So that's been going great, that collaboration. We've also been able to bring together, like you say, resources where trainings and summits, we can bring together information and together, all of our information together and our different perspectives coming together, and then really looking at an issue, kind of bringing it down to first building the relationships, first building community, and then looking at what are the issues we can focus it on, such as public transportation, which is huge to making people's lives better and living healthier lives.
Right. So going into that issue of access to transportation, that was the first issue that Fox Valley Thrives kind of is testing out in this new coordinated alliance. So what are access to transportation? Penny, you kind of said it is something that ESTHER's been working on for a while, and from the public health side, we know that if people can't get around, that lots of bad things can potentially happen, including poor health outcomes. So what are some of those obstacles that residents are currently facing when it comes to access to transportation in the Fox Valley?
Well, although most of area bus rides are to get people to jobs and school, neither the Oshkosh buses nor the Fox Valley buses go everywhere where people need to go. So, and they don't run on Sunday or late in the evening. So there's just not enough of public transit. In addition, many roads are not safe for people to bike or to walk, especially the children and elderly and people with disabilities. So we need good transportation options with different modalities so people can get to good paying jobs, to medical appointments, to shopping at good grocery stores, to social events, so individuals are not isolated and alone at home.
So that's a lot of concerns for a large amount of folks in the area. So what can be done to ensure better access to transportation for all of our residents, Susan?
Yeah, I think really what we want to look at is policies out there that are really impacting our transit system. One of them is the funding out there, a better balance of funding for all forms of transportation. So when we look at the transportation budget, if we're only focusing on highways, we're forgetting to really make sure that a priority is including transit, biking, and walking in that entire plan. And when we plan better, plan our communities better to make them walkable, bikeable, and able to access transit, it's inviting to all levels of our society. So it's from millennials up through our senior population, and it really is a better utilization of keeping people healthy through exercise and getting out, as well as getting to their essential needs like jobs. And then also we have policies out there like Complete Streets. Complete Streets looks at the entire what a project's going to go in when it's a Department of Transportation street. We look at the design of the street to make sure it does have that biking and walkability, as well as the street and the components to make it work into the community. Those policies are really important because they do impact and help increase the health of the communities overall.
Yeah, so and we've got a graphic up on the screen right now about some of that funding that you were talking about and a better balance, where a lot of our funding for transportation goes to road, like freeway projects, roads and highways, and funding to local roads and aids for increasing bikeability and walkability have been increasingly diminishing, and that's something that Fox Valley Thrives is working or looking at and trying to let other people know that, hey, that maybe isn't the best way to do things.
Absolutely, absolutely. And we're looking at the fact that if we start paying more money into debt service for more highways, we're going to run into a funding problem, continued funding problem down into the road. Down the road. And so what we really want to look at is that continue to make it a balance and a priority for our communities, and helping our local areas like Oshkosh to make sure we can maintain the roads and offer the walkability and the bikeability for the communities, and then the transit as well. That it's a mix, and we need to keep that as a priority.
Right. And Penny, do you have anything else to add about that?
Well, yes, we have been working with local residents and stakeholders to call to the attention of our state lawmakers about public transportation options, not just transit, but also complete streets, sidewalks, bike lanes, and crosswalks. And legislators really pay attention when their constituents, people in their district, call in about some of these districts. For instance, when I am too old to drive, I really want to make sure that there's fully funded transit and sidewalks and crosswalks for me to use. And it's really easy to call your legislator and just say, you know, it's really important to fully fund transit and complete streets. Usually a staff person answers, and they're very polite, and they take a message. But believe me, our senators and our representatives pay attention when people call. And if individuals don't know who their legislators are, who are supposed to be representing them, they can go to the website www.legis.wisconsin.gov, and you can find out who's supposed to be representing you.
Awesome. Well, thank you both for being here today. We will keep tuned on some of those budget implications, and depending on when you're listening or watching, things might look a little bit different. But again, thanks for both being here and talking about some of those upstream ways to make positive changes to the landscape of our community and the health of our residents. So up next, we've got a great video showcasing our Cooking It Fresh Challenge, which was held on April 19th at Oshkosh North High School. And it's got some chefs and some local celebrities and lots of yummy food. So we'll be back right after that.